Hello and welcome to Dr. Mark Hyman Official. I'm Dr. Mark Hyman, a medical specialist with over 10 years of experience in healthcare. On this channel, I share trusted health tips and medical insights to help you live a healthier life. Please subscribe, follow, and support the channel. Today we'll discuss 5 medical checkups I'd never get after 65. Doctor explains. 5 medical checkups I'd never get after 65. Doctor explains. As we get older, we're often told to schedule more tests, more screenings, and more appointments. It can feel like every year adds another checkup to the list. But here's something that may surprise you. After 65, more testing is not always better. In fact, some medical checkups may offer little benefit, and in certain cases, they can even cause harm. Let's talk about 5 medical checkups that may not always be necessary after 65, depending on individual health and circumstances. First, routine full-body CT scans without symptoms. These scans are sometimes marketed as a way to catch everything early. However, they expose the body to significant radiation and often detect harmless abnormalities that lead to anxiety, repeat scans, or even unnecessary procedures. Without symptoms or specific risk factors, these scans rarely improve outcomes. Second, certain cancer screenings beyond a specific age. For example, routine prostate cancer screening in older men or cervical cancer screening in women who have had consistent normal results may no longer be recommended after a certain point. Many cancers grow very slowly, and in older adults, they may never cause problems during a person's lifetime. Screening can sometimes lead to overdiagnosis and overtreatment. Third, routine stress tests without symptoms. If someone has no chest pain, shortness of breath, or known heart disease, performing a stress test just to check may not provide useful information. False positives are common and can lead to invasive follow-up procedures that carry their own risks. Fourth, frequent bone density scans without risk factors. While osteoporosis screening is important, repeating the test too often in low-risk individuals may not change treatment decisions. Bone density changes slowly, and testing too frequently may not add value. Fifth, annual blood work panels that go far beyond what is clinically necessary. Broad testing in healthy, stable adults can uncover minor abnormalities that are not dangerous but lead to more testing, worry, and cost. Targeted testing based on medical history is often more effective. The key message is not to avoid healthcare, it's to make it thoughtful and personalized. After 65, the focus should shift from aggressive screening to meaningful care, managing existing conditions, preserving mobility, protecting cognitive health, and maintaining quality of life. Medical decisions should always be individualized. What's unnecessary for one person may be important for another. The goal is not to chase every possible diagnosis, but to support longevity, independence, and well-being. Sometimes the best care isn't about doing more, it's about doing what truly matters. More testing after 65 is not always better because medical care should be guided by benefit, not habit. As people age, it's common to assume that increasing the number of tests automatically improves health outcomes. However, every medical test comes with potential downsides, including false positives, unnecessary anxiety, additional procedures, and sometimes even physical harm. The idea that more information is always good does not always hold true in healthcare. Screening tests are designed to detect disease early, but in older adults, the balance between benefit and risk changes. Some conditions grow so slowly that they may never cause symptoms during a person's lifetime. Detecting them can lead to treatments that may not extend life but can reduce comfort or independence. For example, biopsies, surgeries, or aggressive therapies can carry higher risks in older individuals, particularly those with other medical conditions. False alarms are another concern. Many tests identify small abnormalities that are technically outside the normal range but are harmless. These findings can trigger a cascade of repeat tests and specialist referrals. This process, sometimes called a diagnostic cascade, can create stress and expose patients to procedures that may not have been necessary in the first place. There is also the emotional impact to consider. Waiting for results, dealing with unclear findings, and facing unexpected diagnoses can create significant anxiety. Quality of life matters just as much as longevity. Healthcare after 65 should focus on maintaining function, comfort, and independence. Instead of automatically ordering more tests, providers often weigh whether the results will truly change management or improve well-being. Thoughtful, selective testing can protect both physical health and peace of mind, ensuring that care remains purposeful rather than excessive. Full-body scans without symptoms can appear appealing because they promise a comprehensive look inside the body, often marketed as a proactive way to detect hidden disease. However, for adults over 65 who are not experiencing specific symptoms, these scans often create more problems than they solve. One major concern is radiation exposure. CT scans use significantly more radiation than standard X-rays, and repeated exposure over time can slightly increase the risk of developing cancer. While a single scan may pose minimal risk, routine scans scanning without medical necessity adds avoidable exposure. Another issue is the high likelihood of incidental findings. These are small abnormalities that are discovered accidentally and are usually harmless. Examples include tiny lung nodules, benign cysts, or minor structural variations. While most of these findings never cause health problems once discovered, they often lead to additional imaging, biopsies, or specialist consultations. This chain reaction can cause stress, financial burden, and potential complications from invasive procedures. False positives are also common. A scan may suggest a problem that ultimately turns out to be nothing serious, but confirming that requires further testing. For older adults, follow-up procedures such as biopsies or contrast imaging carry greater risks, including bleeding, infection, or kidney strain from contrast dye. Most importantly, research has shown that routine full-body scans in people without symptoms rarely improve overall survival. They do not reliably prevent major illnesses, and they do not replace regular, targeted medical care. Healthcare works best when tests are ordered for clear clinical reasons. Imaging should be guided by symptoms, medical history, or specific risk factors. Without those indications, full-body scans can shift the focus from meaningful prevention to unnecessary investigation, potentially affecting both physical health and peace of mind. Certain cancer screenings may no longer be necessary after 65 because the benefits of early detection can decrease with age, while the potential harms may increase. Screening programs are designed to find cancer before symptoms appear, ideally improving survival and treatment outcomes. However, many cancers grow slowly, especially in older adults. In some cases, a cancer detected through screening may never become life-threatening during a person's natural lifespan. Treating such cancers can expose individuals to surgery, radiation, or medications that may reduce quality of life without significantly extending it. For example, prostate cancer often progresses very slowly in older men. Screening may detect small tumors that would never have caused symptoms. Yet once identified, these findings can lead to biopsies, which carry risks of infection and bleeding, followed by treatments that may result in side effects such as incontinence or sexual dysfunction. Similarly, women over a certain age who have had consistently normal cervical cancer screenings may not benefit from continued testing, especially if they are no longer at risk. Another factor is overall health and life expectancy. Screening tends to offer the most benefit to individuals who are likely to live long enough to experience the advantages of early detection. For someone with serious chronic illnesses, the immediate risks of testing and treatment may outweigh the long-term benefits. False positives are also more common with age. An abnormal screening result can trigger additional imaging, biopsies, and emotional distress. Each step carries its own risks and uncertainties. The decision to continue or stop cancer screening after 65 should be individualized. It depends on personal health history, family risk factors, and overall well-being. Thoughtful discussions help ensure that screening supports health without exposing individuals to unnecessary harm or burden. Routine heart stress tests and frequent imaging scans are not always necessary for adults over 65, especially when there are no symptoms such as chest pain, shortness of breath, or reduced exercise tolerance. A stress test is designed to evaluate how well the heart functions under physical strain, usually to detect blocked arteries or reduced blood flow. While this test is valuable for individuals with clear warning signs or known heart disease, using it as a routine screening tool in healthy, symptom-free older adults often provides limited benefit. One concern is the possibility of false positive results. Stress tests are not perfect, and sometimes they suggest a blockage when none exists. This can lead to additional procedures such as coronary angiography, which is invasive and carries risks including bleeding, infection, or adverse reactions to contrast dye. For older adults, these risks are higher due to existing medical conditions or increased frailty. Frequent imaging scans can create similar problems. Repeated testing may detect minor abnormalities that are clinically insignificant but difficult to ignore once discovered. This can trigger a cascade of further evaluations, specialist referrals, and unnecessary worry. In some cases, procedures meant to clarify a harmless finding can expose patients to greater risks than the original concern ever posed. Another important factor is whether the results would actually change treatment. If someone is already managing blood pressure, cholesterol, and lifestyle factors appropriately, an additional routine stress test may not alter the care plan. Good preventive heart care often focuses on controlling risk factors rather than searching for silent disease. Medical decisions should be guided by symptoms, risk level, and overall health status. When testing is targeted and purposeful, it can be life-saving. When done routinely without clear indication, it may add risk without meaningful benefit. Personalized, meaningful care becomes especially important after 65 because health priorities often shift from aggressive detection to maintaining independence and quality of life. Rather than focusing on performing as many tests as possible, healthcare decisions should center on what truly benefits the individual. Every older adult has a unique combination of medical history, physical ability, medications, and personal goals. A tailored approach respects those differences and avoids unnecessary interventions. Managing existing conditions effectively is often more valuable than searching for new problems. Conditions such as high blood pressure, diabetes, arthritis, or heart disease require steady monitoring and thoughtful adjustments in treatment. Ensuring that medications are appropriate, dosages are correct, and side effects are minimized can significantly improve daily comfort and long-term stability. Regular conversations about symptoms, mobility, mood, and memory provide insight that no single test can fully capture. Quality of life should guide medical decisions. For some individuals, maintaining the ability to walk independently, stay socially active, or live at home safely may matter more than undergoing extensive screening procedures. Preventing falls, preserving cognitive function, and supporting emotional well-being often deliver greater practical benefits than aggressive testing. Shared decision-making is also essential. Older adults should feel empowered to discuss the purpose of each test, asking how it will influence care and whether it aligns with their goals. When patients understand the reasoning behind recommendations, they can make informed choices that reflect their values. Meaningful care prioritizes balance. It uses evidence-based medicine while recognizing personal preferences and overall health status. By focusing on what truly enhances well-being rather than automatically pursuing more testing, healthcare can become more compassionate, efficient, and supportive in the later stages of life. Here's a professional 60-word outro. Thank you for watching Dr. Mark Hyman Official. I hope you found today's information helpful and informative. If you enjoyed this video, please like, subscribe, and share it with your friends and family. Your support helps us create more valuable health content. Don't forget to turn on notifications, and I'll see you in the next video. Stay healthy and take care.